Laser vision surgery was approved 12 years ago by the FDA. I'm Molly Cooney. Coming up, we'll talk to patients who had the surgery done several years ago and find out how they're doing now. Plus, we'll talk about the latest in procedures.
Welcome back, everyone. Millions of people have undergone laser vision surgery here in the United States since it was first approved by the FDA in 1995.
And are those early surgeries still holding up? What has happened since then when it comes to improving your eyesight? Well, health reporter Molly Cooney joins us now. So you checked in with some folks that you talked to 10 years ago.
10 years ago. We tracked them down. So, yeah, so you never know. Yeah. We always, keep track of everybody. But anyway, we did find her. And when you think about it, laser eye surgery hasn't really been around all that long, but chances are you know someone who has had it done or is seriously thinking about it. Well, we wanted to find out what has changed since then. Plus, as we said, we did catch up with one of the first patients to undergo the treatment here in Des Moines 10 years ago to see how she is doing now. We first met Kenzie Alderson of Nevada in 1997 when she was one of the first Central Iowans to undergo laser surgery at the newly opened Laser Eye Center.
I have a small child, so getting up in the middle of the night, I wasn't able to see what time it was, wasn't able to see my alarm clock. I always had to wear my glasses when I was watching TV in bed or whatever. I don't have to do that anymore.
That was Kenzie 10 years ago. Here she is today, working at the McFarland Eye Clinic in Ames as a contact lens coordinator. Before her surgery, her eyesight was 20/400. After surgery, 20/20. And now, 10 years later,
I haven't had any updates done. I've had my annual eye exams, and I don't need glasses. I'm 20/20 without glasses.
If the laser vision correction is done properly, which means the surgeon is involved in the pre-op counseling and screening of the patient, a very careful screening, and then doing the surgery and following the patient himself or herself, the chance of coming back and tweaking, which is known as enhancements, is probably less than 1 or 2%.
It's good to see you.
Dr. Hussein is with the Laser Eye Center, a cooperative effort between Iowa Methodist and Mercy Medical Center. He says laser eye correction is into its 4th generation of lasers, extremely safe and extremely precise.
Now we can measure the unique imperfections which are specific to your eyes. Just like your fingerprint, your vision is unique. And we can actually measure those imperfections through custom wavefront guided techniques and then use them to give you a treatment that is specific and tailor-made to your needs.
Laser vision correction is elective surgery for those patients who are at least 18, nearsighted, farsighted, or with an astigmatism. The beam reshapes the cornea and corrects vision. It's not for everyone, and there are risks involved, such as scarring or infection. For many, though, the results are immediate. Doug Hahn had surgery 5 years ago after 19 years of wearing glasses.
The liberating feeling of having this LASIK procedure, going from 2400 to better than 20/20, I'm 20/15, and maintaining that for the past 5 years of not having to be tethered to some sort of corrective lenses like glasses or contact lenses.
Do you know when you're going to be deployed? Michael Vox had the procedure 2 years ago.
This year. Actually, I was a little nervous coming in because, you are talking about your eyes, something that and this is a one-shot deal. It either works or it doesn't work.
Michael went from 20/600 to 20/15 and holding. The same for Lynette McCarthy of Des Moines, who had surgery just 1 year ago.
Had the surgery, and immediately afterwards, I could see the clock on the wall.
As for Kenzie, wearing glasses now is a very distant memory.
It's been a long time. No, I don't honestly for sure remember having to get up and put my glasses on or my contacts on in the morning. It's been long enough that I don't remember that.
Now, since this is elective, it is mainly out of pocket, an average of $2,000 per eye. Eye specialists also caution to be aware of misleading ads or high-pressure sales tactics that may offer a discounted price. They encourage patients to go to a reputable, well-established service where the doctor follows you through the entire procedure, and there are several located here in town.
It's such a cool technology, Molly.
It is amazing, and they say, 4th generation and very safe, very few side effects.
And will they ever need glasses?
A good question. Eventually, they all, when they reach their mid-40s, will need these handy reading glasses, and they can do some kind of corrective surgery when they're doing the laser to maybe kind of put that off a few more years. But yeah, these are pretty much inevitable.
All right.
So, sorry.
Thanks, Molly.
And Kevin had contacts. He never had LASIK. Just want to clear that up, yeah?
Thank you, dear. We'll be right back.